Aminoglycosides are a group of bactericidal antibiotics which act by inhibiting bacterial protein synthesis. Their use is restricted because of potential side effects as they can cause ear and kidney damage. All the aminoglycosides resemble each other in antibacterial activity, pharmacokinetics, and toxicity. Aminoglycosides are not well absorbed when given orally, so need to be given intravenously for systemic infections. Aminoglycosides are used when other less toxic antibiotics are contraindicated or ineffective. They are mainly active against aerobic gram-negative bacilli, staphylococci, and Mycobacterium tuberculosis, but lack activity against anaerobes. There are 5 examples of aminoglycosides, and these are streptomycin, gentamicin, tobramycin, amikacin, and neomycin. There are 10 uses of aminoglycosides drug, and these are pneumonia, MRSA, or what we call as methicillin-resistant Staphylococcus aureus, wide variety of gram-negative and some gram-negative bacteria, upper respiratory tract infection, endocarditis, bacteremia, sepsis, or in short, aerobes only, given topically for skin infections, oral neomycin before elective bowel surgery, severe pelvic inflammatory disease, and urinary tract infections. Streptomycin is used for tuberculosis, subacute bacterial endocarditis, urinary tract infections, peritonitis, septicemias, brucellosis, plaque and enterococcal endocarditis. Streptomycin is active against the following sensitive organisms, and these are: number 1, Mycobacterium tuberculosis. Number 2, Brucella. And number 3, Yersinia. Gentamicin is used for respiratory infection in critically ill Pseudomonas, Proteus, meningitis, subacute endocarditis, and sepsis for enterococcal endocarditis. The sensitive organisms are: number 1, Pseudomonas aeruginosa. Number 2, Proteus. Number 3, E. coli. And number 4, Klebsiella. Tobramycin is used for gram-negative infections and Pseudomonas, and the sensitive organisms are Pseudomonas and Proteus. Amikacin is a protein synthesis inhibitor, and the sensitive organisms are: number 1, Pseudomonas, number 2, Proteus, and number 3, Staphylococcus infections. Neomycin is used for infected wounds, burns, ulcers, conjunctivitis, and external air. And the sensitive organisms are gram-negative bacilli and some gram-positive cocci. Sulfonamides are synthetic bacteriostatic antibiotics that competitively inhibit conversions of para-aminobenzoic acid to foliate synthesis and ultimately purine and DNA synthesis. Humans do not synthesize foliate but acquire it in their diet, so their DNA synthesis is less affected. Drug examples of sulfonamides with the combinations of trimethoprim are: number 1, sulfamethoxazole. Number 2, sulfisoxazole. Number 3, silver sulfadiaxine. And number 4, sulfacetamide. Spectrum broadened with the additions of trimethoprim, sulfamethoxazole, trimethoprim combination is commonly used. Organisms sensitive to sulfamethoxazole, trimethoprim combinations are: number 1, Klebsiella pneumonia. Number 2, Escherichia coli. Number 3, Salmonella species. Number 4, Shigella species. Number 5, Pneumocystis irveci, or formerly known Pneumocystis carinii. And number 6, Haemophilus influenza.